Hey, I'm Dr. Owens at Owens Dental, and today I would like to answer some questions about sedation dentistry. We often get a lot of questions. We have a lot of interest in sedation dentistry, so this video is to kind of put some of those questions to rest and let you guys get some information on it. So sedation dentistry is when we use medication. Could be orally, could be given by IV, but we use medication to calm anxieties. So we have an anxious patient who comes in, anxious about dentistry, and we can get by some of those fears using medications. The medication we use is called an anxiolytic. Okay, so that's just a fancy word. Anxio means anxiety, and lytic means to kill. So it's just a fancy word for killing anxiety. That's the medication that we use. So it's really, really good. That's what it's designed for. Yes, it does cause many people to go to sleep, but the real purpose is to kill anxiety so you don't care what's going on. And the sedation that we use is much safer than general anesthesia. The difference is general anesthesia is what they use in the hospital, and that's when they're going to intubate you, and that because the medications that they give you cause it to where your respiratory system and your lungs, you can't breathe on your own, so they have to use a tube to breathe for you and things like that. That's not what we do. Our facility is an outpatient facility, so we don't do any of that. Everything that we do is very safe. In fact, you can breathe on your own. All your bodily functions work normally, except for your brain. Your brain's not working normally because we're taking away that fear. There's two basic types that we use. The one we use most commonly now is IV sedation. That's because it's, to me, the safest way to give and also the most predictable. And that's where we deliver the medication directly into a vein through an IV. There's another way that's called oral sedation. We don't use as frequently anymore. We do use for a lot of pediatric cases, but and that's where the medication is given orally. The reason we don't use it as much is because it's less predictable. I can't tell how much is going through the GI system, how much is getting to the bloodstream. So it's not quite as predictable, not quite as potent. The IV sedation is my preferred way, but we use both. They use the same thing. Most oral surgeons are going to use IV sedation. They use the exact same medications that we use, so there's really no difference. What you're going to expect is once you're given the IV or given the medication, you're going to expect to feel relaxed. It has what we call a retrograde amnesia, which retrograde just means before, so you're going to have amnesia. You're not going to remember probably even coming to the office. It's going to cause you to not remember the procedure, not remember being there, which is kind of the point, right? It's also going to make it where you don't care what's going on, you don't care what we're doing, but you're still able to respond to me. If I say open wider or turn towards me, you'll follow commands, you just don't know that you're following commands. That's a case-by-case basis. I mean, it really depends on the type of extraction we're doing, and it depends on the patient. Some patients can have the most difficult extraction and don't need any sedation. Some patients have a very, very simple extraction and need IV sedation. So it just depends on a case-by-case basis and what the patient needs. There's no pain involved with it, besides maybe getting the IV, which is pretty much painless. I never really had anybody complain about that in hundreds and hundreds of cases. So I would say it's painless. The medication goes in painlessly, and next thing you know, you're awake and the procedure's over. So side effects, there's always a risk involved when we're giving medications into your body. Most of the medications we use aren't respiratory depressants, meaning they don't cause you to not be able to breathe as well. So the risks are minimal, but there are risks involved. Sometimes some people will experience nausea when they wake up. They can have a little bit sick to their stomach. Sometimes it may take them a little bit longer to wake up, depending on the amount of anesthesia that they need or sedation that they need. So it can, in very, very rare cases, it can be risks more severe that we'll go over at your appointment, but that's actually super, super rare. So while there are risks, it is very safe. It's very simple. When you come in for the treatment plan, usually I can kind of fill it out when I'm talking to you and see, hey, you're pretty anxious, you probably need sedation. But also just ask. That's all you have to do. I mean, as we're talking, let me know what your fears are and what's going on with you mentally, and then we can get it taken care of. Anything from a light sedation to a deep sedation. We can do it all to help you be more comfortable. So if you have any more questions or you have any concerns, I want you to reach out to me. If you have interest in sedation and you want to know more about it, I want you to reach out to me. Come in, get an appointment, sit down with me, sit down with Dr. Carter, some of us who do sedation, and ask your questions, and we'll be happy to put your mind at ease and let you know what we can do for you.